Welcome to the Weird Works podcast. I'm Dr. Kristy, your host. Join us for conversations about alternative and sometimes controversial healthcare topics. This podcast will provide the evidence that you need in order to make informed decisions about your health, to empower you with the facts that you need to advocate for your health, and to encourage you that there is hope your body heals. Join us from experts from all things weird, as well as the testimonies of people with stories of radical healing who were once told that perhaps their condition was a death sentence, that they would just need to live with it, or that drugs and invasive surgery were the only answer. Let's get into agreement that if there is something natural and non-invasive that could be helpful, that it could be your first option rather than your last resort. Hey everybody, it's Dr. Kristy here, and I have a brand new topic to talk to you about today. We're going to be talking all things regenerative medicine, stem cells, PRP, human tissue cell therapies. And so I'm also excited to announce that this is a brand new division that we're going to be introducing here at Health by Design in the next couple of months. So I wanted to come on and give you guys some background and explain how these exciting therapies can be a non-surgical natural intervention for chronic pain and talk to you a little bit about how it works. So this always comes out of necessity. Every time we decide to bring in a new modality, it's out of need. And also what we realize is that maybe there are these therapies already here in Jacksonville, but our patients aren't necessarily exploring those options. And so I thought that if we brought it here on site and you knew the staff that we bring on to provide these things, that it would remove a barrier and more people would have access to these forms of care. There is a need for it in our area. I know patients have traveled like across the state and out of state and even out of country for some of these therapies. And also I find that even though there are places that are providing regenerative medicine and stem cell therapies and joint injections, our population of people aren't the first that are just going to march into a medical treatment facility and have ultimate trust. And then the fourth thing that we found in exploring if these therapies were already in our area was that their reviews or their statistics as far as promising improvement or results were pretty limited. And I feel like we figured out why that was. And it has a lot to do with who is a good candidate and who isn't a good candidate. And I feel like the patients here at Health by Design, if you're already doing the diet and lifestyle, we're already reducing inflammation on multiple levels with you, and we've got all that stuff in check, that increases your odds for these therapies to give you long-term improvement. Whereas some of the facilities that we were comparing reviews for probably are just accepting anybody off the street, regardless of lifestyle or things that they're doing to contribute to the improvement of their own health. Another thing that I thought would be helpful is that we can give you the Health by Design stamp of approval, and that we can apply the same scrutiny that we would for the materials and for the products and the training and for the staffing of these services as we did with anything else. So you know that we have a high standard for bringing you the cleanest products, things that are ethically sourced. We talked about pre-qualifying candidates, and also making sure that we're using the best ingredients and that we have a like-minded medical integrated team. And lastly, of course, this is completely in alignment with our philosophy to restore function naturally. So the alternatives, the traditional therapies for chronic pain conditions and degeneration and arthritis have always been cortisone injections, and if that doesn't work, there's a booster shot to put some lubrication in the joints, and then third, ultimately, is surgery. And we know that our population of people want to do everything that they can to prevent the need for pharmaceuticals and invasive interventions like surgery. But these therapies not only restore function, but they help repair and rebuild and heal the tissue in a drugless and surgery-free way. So like, yay, this is amazing. So if you're listening, then you're probably because you or somebody that you know has been diagnosed with a bone, joint, ligament, tendon, muscle, or nerve problem. So that's all your musculoskeletal system. Probably the idea of surgery or these cortisone injections makes you uncomfortable. You're not really sure about the safety or effectiveness long term. Or maybe you've already tried one of the above and haven't gotten a real resolution. Your symptoms come back or it didn't work at all. A lot of patients that we surveyed already would do anything before it comes to doing any of the above and are looking for natural alternatives. And probably the chronic pain that we're talking about has started to get in the way of you living an active and fit lifestyle, or get in the way of the things and hobbies that you love to do, or being able to play and show up fully with your family, or do your job. Like if you have a manual labor job like I do, chronic pain can really get in your way of productivity. And it's exhausting, not to mention. Maybe you want to age gracefully, and maybe you've heard buzzwords like what we chatted about in the intro about regenerative medicine, stem cells, or PRP, and you're wondering if these could help with whatever health condition that you're struggling with. So today we're going to talk to you about the field in healthcare called regenerative medicine, and that name can be applied to multiple modalities can fit within this regenerative medicine umbrella. But by definition, when we say regenerative, what we mean is to bring into existence again. And as always, I always say, if you stay to the very end, I'm going to make sure that you leave with hope and answers and strategies that you can begin to implement a game plan for yourself right away. We are going to take a live symptom assessment together because I want to make sure that you are pre-qualifying yourself to see if this is something that you could consider. And then if so, if you answer the questions on the assessment that you are a good candidate, we're going to give you a pre-launch discount for being one of the very first to take advantage of these services at Health by Design. So don't miss it. Regenerative medicine. So by definition, it's a form of molecular biology which deals with the process of replacing, engineering, or regenerating human cells, tissues, or organs to restore or establish normal function. So in our practice, we will be using human cellular tissue products, and we'll explain that more, and protocols that are designed to restore your injured or painful area to as close to normal as possible. So restoring function is going to be a big recurring theme you're going to hear. And so these procedures don't only eliminate pain or the symptoms, but actually repair, rebuild, and heal the problem area. So you guys know this, like lizards, if they lose their tail, the tail grows back, or a starfish loses one of their arms and the arms grows back. That's exactly what we mean by regeneration. We're not going to be regrowing limbs, but we can regrow cartilage, ligaments, tendons, connective tissue that are in an injured joint. And so the products that we use are, you're going to hear the word biologic, and that means that they come from a living organism. So how do we get these tissues? What do we mean? So it's nothing weird or illegal. It's nothing that's unethical. It's actually really interesting when I found this out, because I personally didn't know that we could use stem cells in America that weren't from your own body. So we used to think you had to use your own stem cells. And what we're going to talk about in a little bit is that your stem cells are as old and degenerated as you might be. And so they don't reproduce and have the same biological activity for all this regrowth and regeneration as they did when we were an infant or when we were 2 years old. But we're not talking about using anything. There's no aborted tissue cells. They don't come from a fetus or an unborn embryo. There's actually a tissue bank where when a woman has a planned cesarean section, they can volunteer to donate their umbilical cord and the placenta and the amniotic fluids that had surrounded the fetus once the baby is safely delivered. And so then this donated tissue and the patient, both the pregnant mama and the baby, are carefully screened to rule out any form of disease. so that they can become available to be transplanted into another person. And these donated tissues are always from a live birth that was a successful, healthy birth. There were no abortions involved, and it will therefore not be rejected by the person who receives them because it doesn't create an immune response. So those are usually the biggest questions and concerns that people have right off the bat when they hear stem cells. So the reason that you don't have to worry about rejection, fetal tissue cells contain a particular molecule that makes them immune privileged. So your immune system will accept the transplant. So it's not like when somebody gets an organ transplant and there's a risk of rejection and tissue matching is necessary. Nothing like that needs to be done. So there's all these different cells in the body, bone cells, blood cells, skin cells, nerve cells, muscle cells, whatever organ the cell is from. And there's these different amounts of tissues and cells used are depending on the type and severity of the problem you have. This is actually U of R is my old alma mater, University of Rochester. And so you're going to see like a lot of major universities now have a regenerative medicine division that's being studied all across the world. And so we're going to show you a video from Mayo Clinic.
100 cells here that are working together.
The heart muscle cells that Dr. Tim Nelson views highlight recent advances into regenerative medicine.
The simplest way to explain that is it's the opposite of degeneration.
Tissues in your heart, joints, and other areas can degenerate or break down with time or disease. Regeneration is the renewal of those tissues, which is something the body does naturally.
So one strategy is to try to find ways to improve the healing of your body, and another strategy is to actually supplement or augment the stem cells in your body so that we can improve the healing by transplanting stem cells into it.
Dr. Nelson and his colleague Dr. Andre Terzik use stem cells in their research because stem cells are responsible for growing new tissue.
So stem cells just means that they're seeds that can grow into many, many tissues.
Stem cells can come from a variety of places: embryos, which are not generally used anymore, umbilical cord blood, or adult bone marrow.
So the type of stem cell will dictate how many different types of tissues can emerge out of it.
Scientists can engineer stem cells into the type of cells they want. Here's how it works. Cells called fibroblasts are removed from a patient's skin. They are reprogrammed into what are called pluripotent stem cells. Those cells can be taught to become any type of healthy cells, such as these heart muscle cells. The idea is that the newly engineered healthy cells, when introduced to, say, those of a failing heart, will help restore or regenerate the function of the unhealthy cell.
This is one cell that's contracting, is working with many cells, and that gives the whole tissue the contraction pattern like a normal heart. It becomes much more real when you have a personal connection to a disease or an illness where we don't currently have good options. And this is where people are asking more and more the question of what about stem cells?
The answer is researchers such as these at Mayo Clinic push forward to make regenerative medicine a reality for patients searching for successful treatment and perhaps cures. For Mayo Clinic News Network, I'm Vivian Williams.
So isn't that cool to actually see it in action? So wherever we inject the stem cells, it will just help that area of the body function that much better and regenerate and get in synchronicity. So there's also a lot of signaling that's involved with these cells. So like we said, the protocols that we're going to be using have been given to us by a team of medical advisors who specialize in this regenerative medicine procedures and research. And this type of medicine has focused on human tissues that early research seemed to point to being the cause of the regenerating of new tissue in a person's body. So this doctor, Dr. Arnold, he was considered the father of stem cell research, and he gave the name mesenchymal stem cells, or MSCs, their name, but he recently wrote an article and he wants to rename them medicinal signaling cells because of the effect and the, function that it does, like we just saw, getting all the circulating cardiac tissue to start moving, like we just saw. So signaling the cells. This is based on the fact that these cells signal your body to activate healing. And healing occurs when over 200 different growth factors and controllers of inflammation called cytokines are transplanted, and then your previously dormant cells are signaled to kick in and start taking a healing action again. So when we're born, we have millions and millions of these stem cells, and they come attached to our capillaries. But as we age, stem cells either become dormant or non-functional, and that happens after we've reached our full skeletal maturation or bone growth. So if you think about that, that's usually in our late teens to early 20s. So after that time, we only have 10% of our active stem cells available to help us heal, and that's what we have available for the rest of our life. So for the rest of our life, every time we have an injury or we fall or we have a surgery that we need to recover from or some kind of, infection, we only have a certain number of stem cells to use, and every time we use them, they're gone. So then additionally, we said that they tend to come attached to the capillaries. So as we age, we also have less blood cells for them to travel on. So our bodies begin to degenerate rather than regenerate with every decade of life. And instead of just accepting that and, kind of taking the cards you've been dealt, if we transplant the correct tissue in the correct amount into an injured or painful part of your body, we can actually activate those dormant cells, and they can begin to regenerate new tissue, reduce the inflammation, and restore the normal function of whatever that area is. So probably most of you, if you, were joining us for any of the reasons we listed in the beginning, if you had chronic pain, you probably tried a lot of things to solve with possible medications and over-the-counters, because we know when people experience pain, you got to live your life and be able to do what you need to do. But we also know that these medications, while they'll reduce the symptoms temporarily, they doesn't stop the degenerative process and often can cover it up and make it worse. That's what happens, for example, when somebody goes to the emergency room and they do imaging and they say, okay, nothing's wrong, but we're going to give you these muscle relaxers or painkillers to help you feel better. Well, it masks the natural signal that the body is telling you to rest and not use that injured body part. And so it can actually make your problems worse, because now you're not getting the pain signal and you keep using the injured area and can worsen the injury. So of course, like, you might feel better today, but it could be worse for the long run. And then NSAIDs, which is one of the most common anti-inflammatory medications, they can make you feel less pain. But what people don't really know is that a lot of these medications actually destroy the cartilage and contribute to further degeneration. And then stronger meds like opioids, oxycodone, and fentanyl being the most common, reduce pain, but we're all aware of the opioid crisis. And opioid meds are responsible for the death of 1,000 people every single week. That's more than those killed by auto accidents. So when I told you every time we consider bringing in a new modality, it's always out of a need to help reduce people's suffering and provide safer options to, how many people have chronic pain. It's obviously a necessity, and people are looking for things, but they become desperate, and then even though there's these published not good odds, they reach for anything that they can for comfort. So this was in 2017, a Mayo Clinic research article that said cortisone injections have the following risks. So you can get infection every time you get an injection. It can cause nerve damage in the area, thinning of skin around the injection site. It actually can cause a temporary flare of pain in that joint. It causes the tendon or connective tissue to fray or rupture, because it causes a weakening of all those, and those tendons are there to to stabilize the joint. It can thin the nearby bone, so that's called osteoporosis, And in worst case scenario, it can cause death of the nearby bone called osteonecrosis. And this might be another thing that your practitioner might not share with you. For people that have had multiple cortisone injections, it's not recommended that you have more than 3 cortisone injections in any one joint in your entire lifetime because of the harm that it can cause to you. So if you've had repeated injections in the same area, it's not creating a long-term benefit, but it also is causing a lot of other health issues that you might not be aware of. And so then when drugs fail, the only alternative up until now has been surgery. And of course, we know with surgery increases the risk of complications. I think too, it's like, oh, these things are so routine. Like in your lifetime, it's pretty common that people, I think it's become normalized, like to have a joint replacement surgery. I have several patients that have had multiple joints replaced, and we kind of laugh and call them like bionic men and women. But according to the National Inpatient Medicare Database, there have been nearly 5,000 deaths due to knee replacement reported in just 1 year. So it's not without risk, even though it's become routine and it's become normalized. And then if you add the complications of potential blood clots to the lungs or heart attacks or pneumonia related to surgery, there's another 10,000 people who have died. And that doesn't include the 17,500 people who were reported to get infections. So the risks are pretty severe. And then the cost, though, people are like, oh, it's covered by my insurance. I think that's become a normalized thing too. Well, the average knee replacement surgery can cost $57,000, followed by 3 to 6 months of rehabilitation and healing and the cost of all that. And then, of course, being out of work or out of your normal daily routines. And even with good insurance, the deductible and the copay on that could still cost nearly $15,000 to $20,000 as an out-of-pocket expense for people. So I always ask, and you guys are always really good, but if I could tell you that there was a natural way that was safe, effective, and affordable to handle degenerative pain, would you want to know or be interested? So send me a little thing in the chat, and I always see hands going up. Of course you would be interested. It's safe, effective, affordable, and of course I already alluded to the fact that it actually restores function and regrows tissues. We want all of that. Okay, so before we look at solutions for you guys, let's get the survey. If you pre-registered, you would have gotten an email. The survey would have been there for you. If not, no worries. We can email it to you after. Just try to go along with us here. Maybe it'd be a good time to just get a piece of paper and a pen out. Not if you're driving and listening to this on the podcast. You can pull over or pause it and do this later or re-listen to this. I'll put the links in the show note also for the survey and the videos if you want to go back and rewatch those or download them after. Okay, so if you have a copy of the survey in front of you, please do put your contact information, your name, email, and phone number would be the most critical. An address would be helpful. But this is so that we can follow up with you should you take us up on the discounted consultation. This is going to help me know more about the problems that you are considering regenerative medicine for. So we also want to know about any job and the hours you work, because I want to know about lifestyle factors that could potentially be worsening or contributing to the problems that you're having, and or about your ability to recover post-treatment. So the first question on the survey asks about where you are experiencing your pain. And I'm going to ask you, and you can think about if it's you or you're listening to this on behalf of somebody else. I'm going to ask you if you or your loved one has had A, pain in that area, B, a decrease in emotion, or C, swelling in the last 30 days in the specific areas of the body. So you want to answer if you've had pain, decreased motion, or swelling. And then just put a check mark, yes, for each of the areas of the body that we're going to talk about. So knee, that's pretty common. Have you had pain? a decrease of motion or flexibility or swelling. Then we'll go to the shoulder. If you've had pain, decreased motion, or swelling of the shoulder on either side. Same question for the hips. The ankles is interesting. I think a lot of times when people have some of these larger joints affected by pain, swelling, or decreased movement, that the ankles get overlooked. But if your ankle's not functioning, that can cause knee, foot, and other types of pain as well. So answer it for the ankle and then answer for the foot separately. So if you've had pain, decreased movement, or swelling in the feet, answer the same questions for your elbows. So we get tennis elbows and golfer elbows, bursitis, anywhere on your back. So if you've had pain anywhere in the back or a decrease in movement, like being able to bend forward or rotate, and if you get swollen in anywhere of the back. Same questions for the neck. So sometimes it's a little more obvious when we have decreased range of motion in the neck, because we can't do normal things like just turn to look. If you find that you turn your whole torso instead of being able to just turn with your head, that might be pretty obvious when you're driving, for example, trying to check the lane next to you. Answer the questions for your wrist if you've had pain, decreased range of motion, or swelling. So a lot of people have had carpal tunnel surgeries and haven't gotten an improvement because that carpal tunnel entrapment wasn't the actual issue. And then your hands, how bad is it when your hands bother you and you can't open jars or do regular things, pick things up? I mean, obviously we use our hands for everything. I do as a chiropractor, but not just in my job, just carrying groceries and doing daily house chores. So if you've had pain, swelling, or decreased range of motion in any of those areas, either kind of jog it down in your brain or check it on the survey or write it on your piece of paper. So now we're going to put a check mark next to other problems that you've listed that you might have in that column. For example, digestive problems, I don't want you to rule out like, oh, that's unrelated, because there are other conditions that you might have that could be caused by the medications as a side effect, or that could interfere with your healing that we need to address. So we want to be completely holistic. And then you're going to fill in what health problem bothers you the most. So I always say, like in my in-office consultations, like of all the things, there might be multiple. If I could wave a magic wand and make any one of your conditions go away, which one of them is the most important to you? Or on the flip side, is interfering the most with your ability to live the life that you want or have the joy and freedom of movement that you want? And then how bad does it get? 1 to 10, like 1 being mild, 10 is completely incapacitating. And how long have you had that problem? And how often do you have it? Like, is it intermittent? Is it every other day? Is it constant? What percentage of the time? And then we're going to have you answer this survey question. Before you had this problem, what could you do that you can no longer do or cannot enjoy because of the pain or loss of flexibility? So not just that you have pain and how intense is it, but what is it interfering with you being able to do? And then we want to look at how your problems are affecting you. So answer this question. Has your problem caused you to have unhappy moods, experience irritability, maybe a reduction of energy? We were talking about how chronic pain is just exhausting. Sometimes you take for granted how easy it is to do certain things until you're, having to limp or compensate for pain and think about every time you move that area of the body. Is it restricting your activities? Or has it made you feel like a burden to your family where they have to fill in, some of the responsibilities and chores because you can no longer do them, or maybe they have to actually take care of you? Has it interfered with sports or the ability to exercise? Excuse me. And has it reduced your enjoyment for life? So all the symptoms point to the fact that you have a problem and that is not being treated successfully if this has been an ongoing thing, right? So, like your car, which is so weird, I feel like sometimes we take better maintenance care of our car and our air conditioners and filters in the house than we do of our own body. But if you had your car came on with a check engine light or check oil light, you wouldn't just put tape over the light so that you can keep ignoring it and stuff it and keep driving it, most likely. Hopefully you wouldn't. And that would be the similar analogy to taking a medication for a problem. So you don't feel the problem and you can push on and do your day, but the problem is still there. So like with anything, you have two choices. You can keep doing the same thing, or you could try something new to resolve it. So today, if we could show you a way to get rid of your problems naturally and affordably, put it in the chat if there's something that you would want to consider doing. I know everybody's like, yes, yes, yes. Well, you're smart. Of course you would want to do it if we could get rid of it naturally and you could afford it. Who wouldn't? Okay, good. I see the hands going up. Thank you. Okay, so let's look at solutions to the problems that you had just written on your survey. So for regeneration to occur, the body needs cells that have the ability to rebuild the injured area. And as we mentioned earlier, the rebuilders are growth factors, fibrinogen, and these MSCs or mesenchymal stem cells. And altogether, they form what we call the matrix. Sounds like an action movie, right? But these rebuilders can be transplanted from, like we said, rigorously screened tissues that are donated at the time of a normal cesarean birth. And then depending on the diagnosis of the problem, there are different tissues and protocols that can be more effective for what should be transplanted for your particular injured area. And the transplanted tissue helps your body to reduce and eliminate pain. It actually can reduce inflammation that's persistent in the area. It can minimize scar tissue. So sometimes people are having chronic pain conditions because they've had surgeries and the surgeries make more of the same scar tissue. It grows back and causes, a space occupying issue, like it's getting in the way of normal joint movement in and of itself. The transplanted tissues can also promote soft tissue growth and generate new bone, cartilage, muscle, ligament, or nerve growth. How cool is that? And also, just as a side note, in medicine, we have heard over the years, like, oh, nerves don't regenerate or heal. Well, they're slow to, and they don't regenerate or heal necessarily with what traditional medicine offers, but they can, in fact, regenerate. So that is false. So human cellular tissue products, these procedures can bring your body the necessary cells to help the body heal naturally. So hundreds of thousands, if not millions of cells can be implemented during a typical treatment to help your body heal naturally. So the choice is to take drugs to reduce symptoms, do surgery with a list of possible side effects, and maybe not even getting a resolution, or receive regenerative medicine procedures to stop or reverse the degeneration. And there are different treatment options based on what would help you the most and also that would fit your budget. So we have a lot of different options. And of course, everything we do is customizable. There's never a, cookie cutter approach. No two people, for example, with knee pain would necessarily get the same protocol depending on what our evaluation shows. So I want to go ahead and answer questions that I know most people tend to have at this point in our talks. The main question we're asked is, what does it cost and does insurance cover it? So that's always what people want to know. So insurance does not yet cover these methods. I always joke too in the office, you guys are used to that with a lot of our services, because they're considered preventative or proactive. So insurance doesn't cover that realm. But even though they don't yet cover it, we never let that be a barrier to having access to these treatments. So if regenerative medicine is not within your budget, we can look for other solutions that you can't afford. But we do have multiple different payment options that nearly everybody can afford, and we have different treatments and different companies that can help us do that. And then people want to know about the safety of it. And so we were talking earlier, there's no issue with matching requirements. There's no issue as far as the potential for your body rejecting these tissues because they're considered immune privileged. So your body doesn't recognize them as a foreign substance that it has to attack or eliminate. And so I know those are the top questions. All of these and other questions will be answered when we evaluate your specific problems at your one-on-one consultation. And only then, when we know the extent of your problems and the causes, will we be able to determine if we can help you and what would be involved in that. So we'll have more one-on-one conversations. And then we'll work together to provide a program that'll fit within your budget and what you want to do. So today, for being on the call with me and listening, and we will honor this for our online community, at least for a short while. So depending on when you're listening to this podcast, you'll have to contact us to see if this offer is still available, because we can only take so many people into the program at any one time. But I would welcome you to come in for a comprehensive consultation and evaluation and to hear our treatment recommendations. And so today we're offering that for $47. And at the evaluation, what we'll be doing, just so you know what to expect, is we'll be measuring the degree of injury. If you have any imaging or films, bring those in because we will review them. If those films are outdated and we need to grab new ones, we can order those as well. And then an analysis of the amount of motion available in the injured area will be performed. So we'll do a range of motion testing and maybe other like orthopedic and neurological tests just to see what function is there versus what is missing. And so if you're on the call with me, there is a QR code. You can prepay the $47 with that code there. And then if you do that, you'll get priority in the scheduling. What we'll do is we'll have my team reach out to you and get you in office for the next available consultation as soon as we can. And that's our purpose. You know, with regenerative medicine, I think we can even further attain our purpose to help you continue to live happier, longer, pain-free lives and stay independent and stay active in doing all the things you love. And so we just know that problems get worse over time when we stuff them down or treat the symptoms only. And so they don't get better on their own without something. So unless you try something new, your problems aren't going to go away on your own. You can't just neglect them. So really, I feel like you have nothing to lose because we're not going to waste your time or money. You know, I'm always sometimes so truthfully honest with you, painfully honest sometimes. But if I can't help you and you're not a candidate, we definitely will tell you. Okay, so if you have your survey already filled out, you can email it to info@healthbydesignfl.com. It's helpful if we can receive those before your appointment, so we can review the information and make the best use of our time together. And all we ask for you is to give us a chance. We just want to help you enjoy your life to its fullest. And thank you always for listening and being an awesome interactive audience. You guys are always an enlightened crew, and I enjoy bringing all this science and technology to you. We'll keep doing our part to keep at the forefront of what's available to help you guys heal naturally without pain, without drugs, without interventions. So I'm Dr. Kristy signing off in good health naturally. This has been another episode of the Weird Works podcast. I look forward to seeing you all soon. Are you tired of going from diet to diet to come up short and feel worse than you did when you started? Or are you just lost with all the mixed messaging out there today and not sure what's best for you and your lifestyle? Maybe you were told that you had to live with your symptoms and accept feeling less than your typical vibrant self. Well, I'm here to tell you the truth. As a practicing doctor of chiropractic, kinesiology, and clinical nutrition, I see people all the time that are just like you, frustrated and starting to lose hope. But I do want you to know that you do not have to give up on the you that you know you could be. There is a way to truly achieve optimal health and also to live your life. I want to share with you how, by doing some small, doable adjustments and taking on a new approach to enjoyable and non-restrictive eating, we can help you start feeling better and begin to see changes in your waistline and start releasing weight in as little as 14 days.